Welcome to our event titled Pandemic Promises, Tracking Service Delivery with Social Accountability. My name is Isabella Chmielewska, and I'm hosting this webinar today with Integrity Action from Washington, D.C. They're based in London. A little bit about me. I am the program manager of Open GovHub, which is a dynamic meeting place that brings together 50 organizations, mostly NGOs, that work worldwide to help open up governments and empower citizens. And we're actually based in DC as well. So this panel, as I mentioned, is co-organized with Integrity Action and composed of speakers from 4 different organizations. And they are Integrity Watch Afghanistan, International Budget Partnership South Africa, Kwale, Youth and Governance Consortium, and Open Government Partnership. And OGP is actually one of our members, and this event is the 3rd in our COVID-19 response series, which we held in the spring and summer, and we'll be sure to share that later along with the recording of this event. So we have gathered here today to learn about social accountability approaches that track if, how, and when services, including healthcare and education, are being delivered during a protracted crisis, such as this one. You'll meet our panelists momentarily, but first, here are some housekeeping pointers. Please use the chat box on the left to say hello and to comment, but use the Q&A box on the right to ask your questions after or during the panel discussion. We'll also be launching some participatory polls, so please be sure to engage actively if you'd like. Before we begin, let me take a moment to thank you for being here today, wherever you are in the world, and would actually love to know. So please vote in the first poll, which I will start momentarily. And now I'm happy to introduce our moderator, Isabel Carmine, the communications manager at Integrity Action. Isabel, please take it from here.
Thanks very much, Isabella. And thanks also for this opportunity to collaborate. And welcome to everybody. As Isabella said, there are people with us from all around the world. And it looks like, you know, during this pandemic, we've all been affected to different extents, and how strong our response and recovery is going to depend on whether those responsible for leading us through this difficult time are doing it properly, which is why we're looking at this question today. How communities and organizations in different countries have continued to hold governments to account on delivering their promises. So both the direct COVID response and also keeping other services running, which are essential to how we address this pandemic and how we get out of it, basically. So I won't dwell on that too much longer. I just want to say thanks again for joining us, and yeah, look forward to hearing from the panelists and also actively getting a lot of questions from the audience who's listening. So I'm delighted to introduce the panel. I'm just going to ask everybody to briefly say their name and their job title and their organization, and please, yeah, just because we're short on time, I may jump in to keep the conversation moving along. But first of all, Adna, would you like to introduce yourself?
Yes, thank you, Isabel and Isabella. I'm Adna Karamehich-Oates. I'm from the Open Government Partnership. I'm based in London, and thank you for having me.
Great. Azatullah?
Hello, everyone. Thank you. My name is Izzatullah Adib. I'm head of the research department at Integrity Watch Afghanistan. And thank you for having me on the webinar.
Okay, thank you. Tracy, would you like to introduce yourself?
Thanks as well. I'm Tracy Jooste. I'm the Senior Advocacy Officer at IBB South Africa, and I'm calling in from Cape Town this afternoon. Thanks.
Great. And Al-Sheba? Sorry, you have to just unmute yourself.
Hi everyone, my name is Al-Sheba OGH from Kwale Youth and Governance Consortium. I'm a board member, and we are based in Kwale County in Kenya. I'm happy to be with you today. Great.
And you're also here on behalf of another organization that you're
Yes, I'm on behalf of 2 organizations, that is Kwale County Natural Resources Network and Kwale Youth and Governance Consortium, where I am the board member.
Thank you. Okay, so just before we jump in, I'll just briefly explain the format. So the panel is going to answer a few questions, and Adna will provide some commentary at the end from a kind of open government perspective, looking at where government and civil society intersect. And as Isabella mentioned, we very much welcome questions, and there'll be time after the panelists answer some questions to look at those, to answer the audience questions, but you're welcome to ask your questions throughout the session. And please actively participate in the polls as well. So let's get started. The first question I'd like to ask is, how have you in your organization adapted your work to COVID-19? And what's the biggest challenge been? And has this turned into a positive outcome or iteration, or is it too early to tell? And I'd like to ask Tracy to start, please.
Thanks, Isabel. I guess maybe I should start by talking about our methodology we were using prior to COVID-19. So IBP South Africa works with grassroots organizations in informal settlements. And our work focuses on basic services, water, sanitation, electricity, solid waste. And we primarily use a social audit methodology, which is a very on-the-ground intensive approach involving a lot of community training, capacity building, gathering data about services, and then using that to hold municipalities accountable. So when COVID-19 hit, and when government implemented a very strict set of lockdown regulations, keeping that community engagement going was obviously a challenge. Informal settlements very quickly became hotspots for infection, as you might imagine, particularly because of inadequate basic services. So with our partner organizations, we realized that it was going to be important to find an alternative way to keep informal settlement communities engaged, connected with government in a time when their needs are arguably greater than ever. And so an initiative called Asivikilani was crafted working with our partners, and Asivikilani means let's protect each other in Zulu. And essentially it's a virtual platform for keeping residents engaged through an SMS survey, which we ran weekly. And with that, we asked them whether they had adequate access to water, whether the toilets were being cleaned regularly, and whether waste was being collected, because those are all municipal services which should be provided, and obviously extremely critical in the midst of the pandemic and because of the risk of infection. And so with that, I think we've been able to keep communities connected to government. So in addition to collecting the information and finding out what's happening on the ground, a very important step for us was to take that information to government and to bring communities into that conversation as far as possible. And some municipalities responded in a way that was really incredible, because they use that information to direct the service delivery response to informal settlements. And I think,
sorry,
okay.
You want to just sum it up in a couple of, yeah.
Sure. No, I just wanted to say that it's been a very valuable tool for expanding our reach and the reach of our partners in informal settlements across South African cities. Yeah.
Great.
So
thank you very much. Azatullah, would you like to comment?
Of course, thank you. Just a little bit background. Integrity Watch in Afghanistan, we are a social civil society organization. Our work is focused on research, community-based monitoring, social accountability and advocacy. With the spread of COVID-19 in the first case reported by the Minister of Public Health, management of the organization decided to first to conduct an oral survey which seeks to understand the generating information on having various COVID-19 spreading. So our work was mostly focused on COVID-19 preparedness of health facilities in the country. Because in Afghanistan received more than 100 million in global assistance to to mitigate the impact of COVID-19. The government has also allocated national resources to combat the pandemic. However, due to lack of public participation, resource management, accountability, and transparency, the funds have been transferred to personal accounts of those in charge of COVID-19 national project. There were issue of the corruption, misuse of the fund. In the wake of this virus, health services become vital while the most vulnerable sector in the country. Additionally, Ministry of Public Health of Afghanistan allocated 50 to 60 million Afghanis fund to each province to tackle the virus pandemic and deliver timely and appropriate health services to citizens and to the affected ones. The virus has claimed lives of many people, especially the elderly. So during the April 2020, the research team worked on a baseline survey in all 34 provinces. The assessment or the survey includes standards of operation procedures on how to receive patients and track them, diagnosis and treatment capacity, access to supply and equipments like ventilators, masks, sanitizer, etc., and other personal equipments. Integrity Watch conducted this survey, and the analysis covers implementing the COVID-19 screening procedures for all incoming patients and availability of important medicine and protective equipments. And also we resituated our community health, community-based monitoring of health. We assigned all our integrity volunteers in the provinces to conduct a weekly monitoring of the health facilities and provide a real-time data and to highlight the risk zone in the country.
Okay.
And also...
just have to ask you to wrap it up, please. Thank you.
Okay.
Is that okay? Thank you. El-Sheba, would you like to comment?
Yeah, just like I said in my introduction, I'm actually representing two organizations, which we're implementing a project which is dubbed Visibility, Openness and Integrity through Community Engagement. In short, we call it VOICE. And in this project, we use the community integrity building approach, where the community take a lead in the whole process. First, in engaging the community to get to know about their rights to monitor projects and why they should monitor the projects. Then they select the monitors who, going forward, continue monitoring these projects, possibly on a weekly basis, to ensure that they're up to date on what is happening on the ground. And the reason why we monitor ongoing projects, it's because it's so easy to fix problems at that particular level, other than waiting for projects to complete and then we come and say there was a problem here that needs to be fixed. So during COVID-19, it was about quite challenging for monitors to continue monitoring normally. However, the situation was not so bad in our country, but what our county was one of the areas that experienced lockdown for about 2 months, and this meant that people could hardly move from one area to another. But the approach that we used actually helped us to adapt well during this situation, because the monitors are just people that coming from a given local area. So they monitor projects within their areas. They don't have to use public transport to access these projects. So they're able to visit as often as possible, and they're able to engage. And the projects that we are monitoring are projects that are funded by the government, both local government and the national government through the County Development Fund. Now, the beauty with the local government is that the leaders are available within our areas. So even if we are to use transport, you don't have to walk long distance, unlike before, where things were a bit centralized.
Okay.
Another thing, yeah, maybe if I finish, if I just look at now, during this process, we are trying to build that spirit of volunteerism, that you are doing this just because there's nothing much that can be paid, but that heart of following up and getting to know the results will finally benefit you is something that actually also helped the monitors to get going despite this COVID-19 situation.
Yeah, great.
Thank you.
Thank you. Thanks very much. And as I mentioned before, we will have a bit more time to expand on these points during the Q&A. So thanks for your patience with us having brief answers. And the next thing that I would like to ask the panelists is what happens in the case if the government has not been delivering what was promised? So, you know, if the government hasn't been ensuring that the funds get channeled properly, or if they haven't been providing PPE, and so on, you know, what happens if your organization is responsible for monitoring that and checking how the government's doing? Has it been possible for communities to push for accountability? And also on this point, I'd like to see if anyone has any examples of how, in particular, people who are more vulnerable or at risk of exclusion have been able to be included in the response efforts. So I'd like to ask Al-Sheba, could you answer that, please? Thank you.
Yeah, okay. What happens when the government has not delivered what was promised? Currently, we emphasize so much on dialogue, engagement. They sit together and actually talk about the problem at hand. If I give an example of some of projects that maybe stalled for almost a year, the contractor was nowhere to be seen, and nothing was going on the site for about a year. But then they had to sit down first as the community to try to look at where actually is the root cause of the problem. If they identify that maybe the problem is maybe their leaders, because sometimes their leadership wrangles and feel that it makes it hard maybe for government to deliver. So they look at where actually the problem is and they start from there. What they do, they do maybe a stakeholder analysis, all the stakeholders that are involved, that who are going to be to be helpful in finding solution to that particular problem. So that's the major thing that we are currently use, and actually it is helping in getting more good results. Another thing, it is very easy for community members to follow up or to demand accountability. And just like I said earlier, it is easy for projects that are ongoing, because at that particular time you are able to question. Once the project is complete, it becomes difficult to start finding now who are we going to engage. Okay. And sometimes the people involved might not want to be involved, because maybe if maybe the problem is the contractor. If he was paid and is gone, he will not be there to listen to the problem. But if it's an ongoing, maybe they would want to sit and then you can discuss and see how best to come up with a better solution.
Okay, thank you, Al-Sheba. And sorry, I forgot to mention before, there's a poll open at the moment, which is asking how COVID-19 has challenged your work. So please respond to that, everyone. Next, I would like to ask the same question about accountability, pushing for accountability to Tracy.
Thanks, Isabel. I would just say that for us, we've needed to have a lot of tools in our advocacy toolbox. So as Elisheba said, it's really important to have those engagements with government, but that's, you know, that's in itself is not sufficient. So we've we've increased our advocacy through social media. We've created videos where communities get to tell their story, and that's helped us get the attention of government departments who previously haven't really necessarily engaged with what we've done. We've also found it useful to apply pressure from different levels, from local government, provincial government, and national government as well, as part of our advocacy strategy. And we're constantly learning, adapting, and innovating our tools for advocacy to achieve the kind of impact that we hope to. Thanks.
Great. That's really interesting, a multi-pronged approach. Azatullah, would you like to add something on how it's been in Afghanistan?
Sure. In our case, our community-based monitoring, social accountability, and also our survey work was focused to see the availability and preparedness of the health facilities. And most specifically, the proper channeling of the funds, and also oversight of the procurements, because there was no a procurement policy for urgent issues, and also to identify risk zone where the risk zone are. Based on our findings, more than 48% health facilities, there was no basic initial screening whenever the patients arrived to the hospital, and also protection availability was very rare. So our work was focused on to find out and to work with the government where to pay attention and how to highlight the risk zone, and where to allocate funds, because there were reports of misuse of funds, and also availability of protection or medicines in some parts of the country. For example, oxygen was a big issue, and also the proper management of the medicine was also another issue that our advocacy department worked closely with the government and with the Minister of Public Health, where to pay attention. And the government lacked the data to identify the risk zone, so we helped them. For example, we were also showing them where in which part of the country they should provide more medicines, like for painkillers, into that details, and where to establish more beds for the patients, because there were some provinces the speed of the virus was very speedy, and the government was not well prepared on that provincial level.
Okay. So the work you were doing was really helping the government to know where the needs were and to respond accordingly. That's very interesting. Thank you. Okay, and the third question, just before we move to the Q&A, I will ask you to try and keep your answers short, please, if possible. Some people have already touched upon this, but during the past 6 months, has your organization observed an increased risk of the misuse of funds or power? And have you found an effective way to mitigate these risks? So would you like to start us off, Azatullah?
Isabel, sorry, can you repeat the question? I think I have
Okay. Yeah, during the past 6 months, whether your organization has seen an increased risk of the misuse of funds, which I think you already mentioned about, but how have you mitigated this risk?
Of course. In Afghanistan, despite $1 million aid from the international community and also from the local sources were allocated for the pandemic, but there were a major bribe and corruption and misused reports by media and also by civil society organization in the country. The president of the country assigned Office of the Ombudsperson to investigate the cases, and they found a huge bribery and misuse of funds in the country. And to some extent, the Office of the Ombudsperson, accused former Afghan health minister of embezzlement of funds and misuse of power, including 3 deputy ministers and also provincial supervisors, the provincial governors. Our work from our organization side, and also from the other civil society organizations. We work closely with the government to follow those cases, and also the procurement issue. For example, there was some very small equipments. The normal price was 1,000 Afghanis, like $20 US. But in the documents of the government, we saw that some of them were purchased by $100, and some were even purchased by 1,000 US.
Okay.
So yeah, so these are the main challenging issues that we are working with the government, but still we have no clear response from the government side in investigating the cases.
Okay, thank you. And El Sheba, would you like to add something about how you've been able to mitigate these risks if you think there's going to be a misuse of funds or power?
Yeah, from our end, we can talk so much about misuse of power. And this normally happens when maybe the people who are seeking information or want to be served are not informed about their rights. So for instance, you might find that you have maybe a government official who is supposed to give you information, but just because they're in power, they refuse to share that information. So some of the reasons that they may use include maybe such a thing is not happening because there's corona. And when you look at whatever that person is saying in relation to corona, it's not adding up. And how we've tried to mitigate it is to make sure that the citizens are informed on their rights and how to demand for their rights, and being consistent whenever they're asking for information. For instance, if you there was a doctor who said that they're not able to come early to work just because he has to get some medicines from another town, so that by the time he reports to that health facility, he has the medicine. But this is totally wrong. It doesn't happen like that. It is not his obligation to walk around to look for medicine to bring in that facility. And because the people who are demanding to get their questions answered, they did not know that it's not his responsibility to do that.
Yeah.
But once they're informed and they're equipped with that information, they know what they're informed prior, maybe any other engagement, they're able to hold them accountable and actually to mitigate that risk of misuse of power.
Yeah, so they're able to engage directly. Okay, Tracy, would you like to add something briefly? Thank you.
Yeah, thanks. I mean, South Africa made headlines, I think, because of corruption and irregularities related to various aspects of the COVID-19 emergency response, irregularities around procurement, for example. And for our work in particular, a lot of the services that we're focused on in supporting municipalities are services that are procured by the municipality. So we've done a big push and we continue to push for transparency around procurement processes, because communities need to know what government plans on delivering, the specifications of the services that the city is promising them in order to hold them accountable. So procurement transparency is a big branch of the work that we do. And then also helping communities to actually interpret those documents, understand what it means for them. And then that supports them around social accountability approaches that we work with them to implement.
Okay, great. Yeah, so a lot of the work is really about making sure communities know what's promised and what they're supposed to be getting, and also how to address that. So if everyone could please answer the poll, which has just popped up, and thank you. And I'd like to ask Adna if she'd like to add some comments from the open government point of view onto what's been said so far.
Thank you, Isabel and Isabella, so much. I think, and thank you again for the invitation to OGP to join this webinar. I think so much of what I've been hearing from the other panelists today resonates also with, with what we're hearing from partners and from our local partners who are actually the ones, who are taking some of these actions and really sort of moving the social accountability initiatives on the ground. So I just wanted to provide a little bit of a perspective from the Open Government Partnerships perspective. Sorry, I'm just trying to find how to do my.
If you click on present.
Yes,
Yeah,
that's
there we
what I'm
go.
looking for.
Yeah,
Thank
sorry.
you so much. Yes, trying to talk and present at the same time. It's multitasking. It's not fun. But you know, just very quickly about the Open Government Partnership. I know that most of you already know the Open Government Partnership. Just for those that don't, OGP was created 10 years ago to bring together champions of reform in government and civil society who recognize that governments are much more likely to be effective and credible if they open their doors to public input and oversight. So the ambition when OGP was founded was to ensure that governments get better in serving their citizens rather than serving themselves. So you see on here some of the major themes that OGP works on, the ones that have had the highest impact. And I'll just note that we're now at 78 countries or 78 national members and 20 local members, which is going to expand by the end of this year. So at the core of OGP is this domestic dialogue. And that's a word that I've been hearing from a lot of the panelists as well, that that's really fundamental for the social accountability initiatives to work. And that's really at the heart of OGP, to bring together government and civil society to co-create together a set of commitments around open government issues or themes that are then locked down in 2-year action plans. And progress is monitored, independently monitored. And the whole idea is by publicly sharing this country progress and challenges that open government partnership can provide credibility and visibility to the reforms, but also to the reformers. So that's, you know, that's always an appeal, I think, for leadership if they're seen as taking the reform initiative in a region or in a country. So in terms of how OGP and OGP members have responded to COVID-19, I think we know that there have been a variety of approaches to the pandemic. I will say that many of them have not been in line with open government values, and this is why OGP has launched the Open Response, Open Recovery campaign and this call to action, because the message being that governments, how governments address the needs of their citizens in this time must be underpinned by openness in order for the response and for the recovery from the pandemic to be effective. And this is because obviously citizens are not just going to be passive subjects or beneficiaries of government action. They're vital and active agents, but also partners in the response and recovery. So you have to, for citizens to be playing a good role in this crisis, a partnership role, they have to trust their government and their institutions. This trust was already at low levels before the pandemic. So, even in normal times, open government approaches can help build that mutual trust. But especially now, an approach, an openness, an open and transparent and accountable approach can really serve to build that trust. So what are some of the open response ways to respond to COVID-19? So it's the proactive and accurate disclosure of information. It's the platforms to mobilize community assistance for healthcare workers and the vulnerable. It's the emergency procurement of medical supplies, public and open. And then finally, integrating transparency, inclusion, and oversight into safety nets and rescue packages. Now, there's also, there's the response, but there's also the recovery side. And beyond the response, open government is also essential in the recovery phase. We are seeing governments now mobilizing the biggest stimulus and safety net packages we have seen since World War II. And we know that when money moves as fast as it has in the COVID-19 response, there's a risk of corruption, as your other panelists have spoken about. So returning to that question of trust, there has to be openness around the rescue packages, and it's a vital opportunity for governments to build back and sustain citizen trust. This is also important because, you know, the international financial institutions are not currently set up to support governments to mobilize that citizen feedback. So it's really, this is where the role of civil society comes in, finding spaces and ways to deepen that collaboration with civil society and government. I'll say an important corollary to this is that you can't have that without an enabling environment for civic space. So civil liberties, basic freedoms of the press, access to information, they're a prerequisite for all of this and for open government reforms. Unfortunately, our analysis also shows that many countries have gone in the opposite direction on that front by shutting down civic space and restricting freedom of information. So very, very quickly, I want to give a couple of examples of some of the ways that OGP members have responded to the pandemic using open government principles and the role, and with the role of citizens as fundamental actors in that response. So we have Paraguay, which created a streamlined process and designated financing, a financing agency to handle COVID-19 emergency procurement. But even though they had an accelerated process, all procurements go through the public procurement information system, and all contracts are published in the public contract system according to open contracting data standards. And then to facilitate public transparency, they also created an app that publishes notifications whenever the government publishes a tender or signs a contract. And then they've also leveraged their open government platform to publish information on COVID expenditures, social benefits, as well as mechanisms for oversight and accountability. Now, this is not an OGP commitment, but as part of the open response and open recovery campaign, it's one of the examples that OGP crowdsourced from its members that could be adopted by other members through also their action plans, and OGP could help scale them up. Another example is the Philippines, where the CSO GWatch oversees citizen monitoring of the government's social amelioration program and has provided the government with recommendations based on their finding. They've also created a citizen's guide to accessing social services. Again, a crowdsourced example that OGP collected. One place we are seeing good uptake, and this will be in my last slide, is in terms of using the OGP platform to ensure a more effective stimulus and safety net package is Nigeria. So a few weeks ago, OGP organized with the Nigerian Minister for Budgets a meeting with key government players like the Accountant General, Auditor General, and the Head of Procurement, alongside the major civil society organizations that are part of the OGP Forum in Nigeria, as well as international partners like DFID, UNECA, Gates, and the World Bank. And there were good discussions on cash transfers, open budgets, formal and social audits, and infrastructure. And this is a model that I think we could replicate in other member countries or OGP locals to bring government and civil society around the table together to discuss how to have this more open response and recovery from COVID. Thank you very much.
Thank you. That was really interesting and fits right in with what everybody else was saying, I think. Great. So I'd like to move now to the question and answer part. And we've had a couple of questions already. So first question I'd like to ask is, has the shift in objectives and expansion in your organization's work because of COVID caused turf disputes with other organizations who traditionally worked in those spaces? And has this coexistence been able to take place, or has competition become a challenge? So the person who asked this asked if Tracy would like to answer that, but if anyone else also would like to answer. We are running out of time a little bit, so I'm going to try and keep these answers a little bit short again. Thank you.
Thanks, Isabel. Actually, the opposite is true. What we found with the campaign was that interest from other CSOs in being part of the initiative grew very quickly. The campaign grew quickly. We started out with 3 CSO partners, and within a few months that grew to 10 partner organizations working across a number of the major cities in South Africa. And so we've been really encouraged that this has been a vehicle for collaboration and cooperation. And I think it's because we have a shared common goal. And obviously it's a pandemic. As I said, informal settlements were hotspots and are still hotspots for infection. And there was definitely a sense of rallying together to support communities when they needed it the most. So haven't experienced any instance of turf or tension between organizations. If anything else, relationships have strengthened through this campaign.
Okay.
Yeah.
Okay, great. Has anyone else experienced this issue, or shall we move on to another question?
Maybe I can add, from our end, we've not had competition, but the civil society organizations normally push for coexistence, and it works for us. For instance, this project, the Voice project that we are implementing in Kwale County, we're implementing 2 organizations. So we've developed the areas where we operate. And another thing, the moment we identify other organizations maybe doing similar or something that is related to what we are doing, we tend to merge forces and see how best we can complement each other. And we've seen other organizations also trying to adapt our way. The number 2, about how we implement these projects, it is citizen-led. So you'll hardly see civil society organizations engaging with the government officials. It is the citizens themselves who will go and sit with their leaders. So at the end of the day, the leaders do not see us in the picture. They see the community. And that is what has kept us going.
Yeah, okay, thank you very much. Okay, I'd like to ask the next question. So would any panelists be able to share any specific tools or resources that might be helpful for CSOs to monitor healthcare budget processes and also local level service delivery related to COVID-19? So would anyone, I see Azatullah shaking, nodding your head. Would you like to mention something about specific tools or resources you're using to monitor for the monitoring?
Yes. In the beginning, we coordinated our work with the Minister of Public Health because we look at their data and they had a system to collect information about the cases only, but not about the other the health facilities level information they were missing. So when we developed 2 applications, one was for the baseline and another was for the daily updates from the health facilities, and also established a team to collect information on a daily basis. For example, head of each health facility, they enter information on a daily basis within 24 hours. And we also have a specific website which shows the data, and the data is a real-time data collection, and the changes are seen on the screen within 24 hours. And then government pay attention to the risk zone, which have been identified based on the data we do collect from health facilities. In this survey, we cover like all 34 provinces, including the district levels. So the reach of the survey is very wide, and we cover more than 1,500 health facilities.
Okay, thank you very much. And this person asking this question also specifically wondered if Tracy could expand on the virtual platform and weekly SMS survey that you're using.
Sure, thanks. So we recently shifted to doing the survey on a monthly basis, and it's a very simple methodology. Our grassroots partners administer a survey where they would ask residents in the communities in which they're working 3 questions about whether they have sufficient access to water, whether the communal toilets are cleaned regularly, and whether waste is collected weekly, which is the service standard they should be expecting. We produce a national report showing what the results are across countries, and more importantly, take that information to the cities directly and focus on where there are hotspots. So where there's a complete lack of water and sanitation in particular, and advocate for service provision to those communities. And very importantly, keeping the communication loop with the communities going. So giving feedback to residents as well about what services have been delivered in settlements and also what city governments are planning to deliver going forward. We do have a website. I'll put a link in the chat if anyone wants to read a bit more about what we've done with the campaign. Thanks.
Thank you. Thanks very much. Okay, and I might move to the next question, just so we can get a few answered. What can the short-term and long-term consequences be in countries like, for example, Tanzania, where the government decided not to impose curfews, which led to no lockdown, and also there weren't incentives imposed to stimulate economic decline? We're not sure I understand this question. I think, yeah, if anyone has any comment on countries where there wasn't a curfew and there wasn't like a kind of lockdown, how things panned out there. Maybe Adna, do you have any?
Well, I think, you know, we have maybe a little bit of an example from Brazil. Unfortunately, that's an OGP member that has kind of denied that coronavirus exists and has taken a little bit of that approach. And I'm sure everybody has seen sort of the results and sort of the pretty bad numbers coming out of Brazil. But I think it often goes then in line with, you know, the lack of transparency, openness, and broad sort of engagement of government with citizens. I think, you know, there's going to be and likely are repercussions in many other spheres, including civic space, which of course is the case in Tanzania, as well as, you know, on freedom of information and access to information. So it's certainly not going to have isolated effects.
Yeah, okay. Thank you for that. And we've got one more question. I think we're going to try to maybe make this the last one, but let's see how we go. And I want to open this up if anyone would like to respond. Do you think the pandemic has made it easier or harder or not had much of an effect on the ability of more elite and professional NGOs to work with local informal grassroots groups? So has the pandemic, you know, has the pandemic enabled this work between more formal and less formal organizations? Does anyone have any? Okay. We might let everyone have a little think about that. And I have a question that I thought I would ask, if you don't mind, specifically about how, whether when adapting the way you work because of COVID, whether community members have also been involved in that. So the people who are perhaps doing the monitoring or doing the engagement and answering the questions, have you been able to engage them in the way the program has been adapted? Would anyone have any example?
Yeah, as I believe, in Afghanistan, just to make sure the quality of the data and to increase the monitoring of health facilities, we collected the data from two different sources. One was the head of each health facility who were entering all the information to the application. And second, we assigned our community volunteers from the community-based monitoring program to monitor health facilities on a weekly basis and provide us the accurate information. They were visiting each health facility and they were providing all the information, including taking photos. So then we were comparing the data with the data which was entered by health facilities. So we coordinated the whole program with the community volunteers who voluntarily were available to work with us. But we only provided them with PPE kits to make sure their health and safety issues.
Thank you. Elsheba, would you have any example of how community members were involved in adapting the programs?
Yes, what I can say is just from what I shared earlier, is like we're trying to make the citizen lead the whole process. Now, actually, COVID-19 gave us an opportunity to gauge whether they can do it by themselves, though they still be expecting us to be there. Because some of them would call us whenever they have meetings, they ask us, can you come, let's do this. Sometimes we'll sit down with them prior to the meetings and maybe develop some advocacy strategies with them. But now with COVID-19, we were not able to go to such areas because we will not be able to meet maybe curfew time. By the time you go there, you come back, maybe you might find yourself in danger. So they were able to push for themselves. And actually during this period, we've seen some of them gaining more confidence and courage to handle these issues. And if I can go back to the earlier question, someone was asking if it has been easier or harder for elite NGOs to do this. I think it has been hard because now with the lockdown, you are not able to go there. Even us from where we are, it's somehow far from where we implement our activities. We were not able to go, but because the communities at that particular area are empowered and they are the ones running the process, it was so easy for them to go. So unless we work with the communities or maybe the grassroots organization, with these restrictions, it's a bit challenging for us to implement.
Yeah, okay. So having a local presence and really having local contact with grassroots actors has been really important for bigger organizations. Thanks for sharing that. Okay, I think we're going to wrap up, and I'd like to ask if anyone would like to add anything that they're going to take away with them. Any of the panelists like to share like 1 or 2 lines just to say what you might take away with you from this session? Any reflections or actions?
Isabel, maybe I'll just jump in and say I'm, really glad to hear that Tracy also said this, that this has been a time that relationships, I think, have been built, that it has brought organizations together and not sort of created turf wars. I think in this response and recovery phase, this is more important than anything, that we are working together, to put pressure on government, but also working with government to create more open and transparent and accountable systems, because this is a challenge that is sort of before all of us, and it requires all of us to participate, just as well as the pandemic requires all of us to participate to protect each other. So it's maybe one of the positive sides of this virus.
Yeah. Okay, thank you for sharing that. And Tracy, would you like to summarize with anything?
Yeah, just to thank Elisheba and Izzatullah in particular for the experiences and insights, and maybe linking to your last question as well, Isabel, about community engagement. And I think Elisheba's used the term citizen focus, and that's so important for the work that we do, and constantly reminding ourselves of that, and having that feature in every decision that we make is really important, particularly because of the distance, because we are working remotely. And so that's something that we are, constantly thinking of ways to improve, becoming more citizen focused, and citizen empowerment as well through the processes that we implement. So it was great to hear from others how they also apply that in their work. So thanks for the opportunity to share and to learn from all of you.
Thanks. Izzatullah, would you have any closing words?
Yes, thank you everyone. Isabel, I think 2 important issues. One was access to information and citizen access to information during the pandemic, and another was the public participation or citizen engagement in the decision making. We had like the same issues in Afghanistan. There were some aid package program by the government, and there was no like citizen engagement and like broader participation of the public. So finally the program failed, and the last and current program is rejected by the parliament. So these are the 2 important things, I think, and these were highlighted by other participants as well. Thank you.
Thank you. Elsheba, would you like to add anything?
Yes, before I ask, there's someone who was asking if you have a link in what we do.
Yes,
And I think,
it.
yes,
Yeah.
maybe you can help Isabel sharing the Integrity Actions website.
Yes, I sent
There's
some links.
information about
Thank you.
what we do. That is KYGC and KCNRN, what
Yeah.
we are doing in Kwale County.
Yeah.
Lastly, I would like to say that actually access to information is critical for social accountability, for citizen-led social accountability. There's nothing that we can do without access to information. And sometimes also engaging the government requires a lot of evidence. So what I can take home is that there's something I've learned from Tracy, generating data, coming up with those tools that are actually going to help communities to use, because we understand the challenges in the remote areas. But if they're able to generate evidence and maybe come up with evidence-based approach, then it means that it is going to be easy for them to engage and actually follow up and have most of these issues handled soon as time possible. Others, thank you so much for this opportunity. It's been a platform for us to learn. And actually the good thing with COVID-19, I've learned a lot for these few months. If I'm to compare from what I learned like 10 years ago, I think it came with some blessings. Thank you.
Yeah, thank you. And thanks, very warm thanks to all our panelists and also everyone who's joined us today. I think I will leave it there. I won't add any more closing remarks, but maybe Isabella, would you like to?
Yeah, just a warm thank you for joining us this morning. Huge thanks to all our panelists and your wonderful insights. And of course, thank you, Isabel, for moderating, and to Integrity Action for partnering with us. So yeah, big thanks from Open Gov Hub. Please try to participate in one question exit survey when this webinar ends. And have a great day.
And thanks again to Open Gov Hub for this collaboration. Great. Great. Thanks, everyone.
Thank you.
Bye.
Bye.
Thank you.
Answer the poll.
Bye.
Thanks.
Bye.
Great. Thank you.